Right. So one of the most common things that I have seen come out in sessions related to infertility is anger. There's a lot of anger, there's a lot of frustration, and this is so internalized that it leads to bigger conflict. It leads to identifying bigger differences between a couple. And for women, what it does is that it, like like I was mentioning, that a client of mine told me that what will I do if I'm like, I also feel like wearing like clothes, like shopping for
Yeah, maternity.
baby products and
Mhm.
things like that. It's because socially we are so focused on this, that it, and because the woman is supposed to be the child bearer, and the the idea or the thought process, the belief system is that she is solely responsible for having a child. Almost that sort of a responsibility is there. So what that does to a woman is that it puts a lot of pressure. It makes her question her own identity as a woman. It can make her it can make her feel guilty a lot of times. There is guilt. There is also there is also this whole idea about what will my partner how will my partner react to this. Will my partner be loyal to me after this or not? These thoughts also cross your mind. The way my family perceives it, especially the in-laws, how they perceive the news or the process. And even so a lot of women, I'll narrate a case to you, Renuka.
Mhm.
This was a few years back, and I had a like a 40 plus, the woman was 40-year-old, above 40, and she came to me and she said that she wanted to adopt a child because she was unable to have a child biologically. However, she'd had a daughter previously, when she was in her 20s, early 20s, like immediately after she got married, and then she was unable to conceive now. So, despite having a child already, that need for nurturance was so strong in her that she wanted a baby, which was great. And when she, suggested to her husband the idea of IVF or adoption, it was completely disregarded by, by the partner and the family, because they said that it's not natural, and it is not something, that if you can't do it, then you can't do it, then, you don't do it. And that put a lot of strain on the relationship as a couple, you know.
Yeah.
And it just diluted the issue. It became more of how incompetent the woman is as a wife, as a mother, etc., etc., from actually what the problem is or what the concern is. And this is despite them having a child earlier. So it
Yeah.
puts a lot of pressure. There's a lot of emotional burden and pressure that is put, and there is a lot of conflict that a woman, goes through when, and even the process. Now, the process of IVF, and you're a doctor yourself. You know this better than I do. What it does is that there's this, and one client actually told me it's humiliating for me to do that because nobody in my family has ever had to go through such a process.
Yeah.
So it's almost humiliating for me to like to go through and have an unnatural birth or a third party reproduction. And
Right.
for a lot of people, adoption is not even an option. you know I mean, I'm sure you must have had those cases as well, where they're like, we don't want to adopt, we want to have our own.
Yeah. Yeah.
And that association, that need for having that need to attach that to a part of your identity is so strong that it just puts a lot of burden on the woman. Now, the coping of it, uh, my first suggestion is relax. The more stressed you are, the more burden you're going to keep on putting on yourself physically as well. There are studies that say that when there is excessive stress, it impacts the IVF treatment and conception as well, right? And that's unhealthy even more. So the first thing would be to relax. Of course, communication is important, and communication has to be two-way. Like I said earlier, it's a couple problem. It's not a woman problem, and it's not the woman who has to communicate alone. It has to be both way. And like I would encourage. So when such cases come, we encourage the partners to discuss how they're feeling, because there's no discussion on the feeling. The focus of attention is ki bacha nahi ho raha hai. There is no, there's an
Yeah.
inability to conceive a child, so that's the focus. And everything else around it becomes irrelevant, or not important.
Yeah. Yeah.
But they don't
Yeah.
realize the impact of all of these things. So the first thing is to share. share your feelings with each other, listen to each other, and try and understand where the other person is coming from, and also know that the solution to this is, can be reached together. Like it is something that can be reached together. And also to avoid discussing it with a lot of people, because these things have a very social impact as well, because there are a lot of people who will have a lot of ideas to come and tell you, do this, do that. And there's a lot of information that comes in, all well intentioned. I'm not questioning that, all well intentioned, but it's important to have like a closer knit safety support at that point in time, because you need to feel more safe than anything else. So the more, you need to have people, you need to share it with people who you're closer to, who you trust. Definitely ask questions to your gynecologist. Keep questioning till you're not satisfied, till you don't get your answers. But also be aware that if you're feeling emotionally drained and burdened, there is no harm in seeking psychological, help or counseling or some sort of a support. And here I also want to highlight the role of the gynecologist or the doctor that the couple is in touch with, because that's where they are the first respondents to this whole situation. Even the mental health impact that the couple might be going through or might be having will first be viewed by the gynecologist or the doctor. We guys come much later into the picture. And how many couples are aware that they need to go and speak to a psychologist? I mean, we know that, right? So this is also where it's important for me to highlight the importance of different professions and different professionals working together to support the patient and the client to sort of decipher and come out of this multi-layered problem.
Yeah, like you said, it's a medicine and healthcare is a multidisciplinary practice by itself. And my addition to this would just be that I definitely think that your gynecologist plays an important role, or any doctor that you tend to visit for this first, even an andrologist or a male infertility expert would be the same, because we are at the screening point, and not a one-time diagnosis. Infertility it's a journey, it's a struggle that couples go through together. So it's very important for them to be armed with every form of help that they can get, most definitely. And there's a lot of medication that you take. There's a lot of treatments that especially the woman has to go through in cases of female factor infertility. And all these hormones are going through your system. So there's also bound to be some mental health changes and exhaustion and all these feelings that you said, that, that anxiety, that hopelessness, that guilt that's bound to go through along with these hormones. It gets amplified, and we need to have a proper channel to take care of it. So my last,
just to add to that, sorry, I'm cutting you.
No, absolutely.
Even while the evaluation treatment for the the evaluation process for the IVF is going on, even that process requires a lot of emotional sort of analysis and understanding of what is the emotional and the psychological makeup of the couple, specifically of are they emotionally ready to, like you said, there are so many problems. Your medication, the medication is going to have side effects as well, and it's a hormonal thing, right? Everything, I mean, whatever happens in your body is going to impact you as a person. So I think counseling and for such cases needs to happen from the word go, from the very beginning. And it's important for doctors and treatment centers to work in collaboration, like from various fields like mental health, physical health, whether it's gynecology or endocrinology or whatever, it's important to work together to give that kind of a support.
Yeah.